Okay. Hi everyone, and welcome to this week's live AMA. Today we are talking about COVID and diabetes and what the links are, what is the impact of these two illnesses taken together. Uh, so Dr. Rahul Baxi is here to talk to us about it. Hi, doctor. How are you?
Good evening.
Welcome back to the AMA. And uh, Doctor, can we, when we are talking about COVID and diabetes, so there are three things that comes to my mind immediately, which is basically how COVID affects diabetes, how diabetes affects COVID. Can we start to talk about that? For example, how does can COVID can the symptoms or severity of COVID or getting COVID in the first place be influenced whether or not you already have diabetes?
Okay, well, this is a very important question which would come into the mind of all our patients with diabetes, even their family members would be worried, yeah, that okay, my parents have diabetes. Will they be at higher risk of getting the COVID-19 infection, contracting the COVID-19 infection or not? So, see, the answer to this, in simple terms, is that if any one of us has diabetes, your risk of getting the COVID-19 infection is probably the same as someone who does not have diabetes. This is the first thing. Okay, so basically it goes all with the precautions you take. All the basic precautions, the COVID-19 appropriate behavior we talk about. We've been stressing about the use of masks, use of social distancing, use of avoiding gatherings in closed places and so on. Hope, I mean, luckily the things are improving now with this third wave or Omicron, what we call it. But you never know. We cannot relax yet. So COVID appropriate behavior is the most important. And even if you have diabetes, probably your risk of getting the infection is the same as anybody else. But what's the other side to it? Why we are discussing this topic altogether today? Why is diabetes important in terms of COVID-19? So, but if you have diabetes and you do get COVID-19 infection, then your risk of getting severe infection, your risk of getting complications, your risk of going into the ICU, your risk of getting on a ventilator, and of course, after that, if things don't go well, the risk of mortality is definitely higher compared to someone who doesn't have diabetes. So, bottom line is that make sure you take all the precautions. You are vaccinated. You wear masks at all time. And again, this is important not only for the patient but also for the family members, because maybe the patient is just staying at home. I have patients who are females working at home only, or those elderly patients who are at home, so they don't go out, but the children do. Family members do. If as a young family member you go out, you don't follow these precautions, you get COVID-19, nothing will happen to you. But you come home, and before you come to know, there may be an asymptomatic phase, you may be infected at that point of time. You give that to your mother or your father or grandparents or anyone at home, you know, who has diabetes or any other comorbidity. They may not be able to fight or survive this infection. That's why, this is why everybody is stressing. People think that, nahi, main to young hu, mujhe kuch nahi hoga. That may probably be true, but, and I know such cases, we all know probably, patients have not gone out, not left their home, but उनको डायबिटीज है या कोई और कोमॉर्बिडिटी है और उनको कोविड-19 हो गया definitely through a family member, and probably things did go back. So this is what the answer to the first question.
Okay. And Doctor, actually, there seems to be some background noise. Can you check your mic once?
Okay, let me.
It stopped now.
Okay, I'll do it without this. Is it better?
Yeah, the noise is gone now. All right.
Okay, yeah,
So,
please tell me.
yes. As you've just said, basically, if we do have diabetes, then the severity of the symptoms, those can be worsened. So, coming to the opposite side of it, which is that, can COVID cause diabetes? And can it worsen an existing diabetes that if you already have
Okay,
it?
again, very, very important. So now we'll divide this into two parts. First, we'll talk about the pre-existing diabetes patient. What happens when they get COVID-19? So this is the first part of the question I'll try to answer. So in such cases, when somebody has diabetes and they actually get COVID-19, uh, first of all, of course, it has to be diagnosed. So you have to, be aware ki what are the symptoms. Get yourself tested according to your local guidelines, and then get in touch with your family physician or a specialist if required, and decide whether you'll be treated at home, or are there symptoms or signs, or your comorbidities are such in some cases whether you require hospitalization or not. Luckily, in this Omicron or the third wave, not many patients have required hospitalization, which is a very, very good thing, for all of us. And many or most of the patients have been managed at home well, with proper guidelines. They've been advised to monitor their saturation, monitor their glucose levels, and, given all the criteria that when they should report back to the doctors. So this is again has been a good thing here. And of course, vaccination has helped us, in this third wave. Probably it is a very, very important factor why we are not seeing so many bad cases, or many patients getting admitted. Last, if you remember the last second wave, people worrying about oxygen, people worrying about hospital beds, and which was real. There was real shortage at some places probably. So this is one good thing. So how can COVID-19 affect your diabetes if you have it already? So again, one important thing in the second wave was that many patients were requiring steroids. You know, Diabetes or no diabetes, if you had hypoxia, that's because patients were worsening. And steroid is an anti-inflammatory drug. And when COVID-19 and diabetes, both of them combine, and even in many other cases also, steroids were used as a very important drug with good evidence. Steroids can shoot up your glucose levels. Even if you don't have diabetes, your glucose levels can shoot up into the diabetes levels. Those levels, say a fasting of 150, 180, 200 is not uncommon to see in someone who doesn't have diabetes, but they are started on steroids. Somebody who already has diabetes, yeah, somebody who already has diabetes and is started on steroids, sugars will shoot up to even higher level. We've seen 300, 400, 500 milligram percent. These are common levels we've seen. Talk about higher levels. I've even seen one patient with almost 1,100, 1,100 milligram percent. This was not a capillary test. This was a lab test, because the capillary glucose, the glucometers which we use commonly, they don't test above a certain level. So that was venous glucose level. But such high glucose levels we have seen when COVID-19 met diabetes and steroids were given. So glucose levels can shoot up when you have this. So how to do that? If you're managing at home, make sure you are monitoring your glucose levels adequately. Make sure you're hydrating yourself well. Drinking enough fluids, especially water, and not sugar-based drinks, of course. Uh, Taking your medications regularly. You have to take your medications regularly, and if anything regarding your diabetes, get in touch with your doctor, because sometimes appetite goes sorry, appetite goes down because of the infection, because of the throat issues, because of fever, and so on. So maybe the medications required adjustment. Maybe you need to cut down on your dosage. If you're in insulin also, you may need required dose adjustment. So it's very dynamic. It cannot be that okay, ये diabetes का course है और आपको 7 दिन लेना है, especially when you are ill. We call it as sick day management. When a diabetes patient is sick, you know the other treatment will continue about for the illness you have. You may have urine infection, you may have pneumonia anytime, apart from COVID also. But diabetes का treatment भी उस समय change होता है, because that is what we call as diabetes sick day management. Because you may have to adjust your medications according to what glucose levels you are seeing, how your appetite is. Say a patient is vomiting, which has been seen in some of the cases of Omicron. Patients are having diarrhea in this third wave, with this Omicron virus. So there you may need adjustment of some of your oral agents also. Diabetes की जो गोलियां, उनमें भी कुछ बदलाव करना पड़ेगा, या कभी-कभी बंद भी करना पड़ता है. And so this is one part. Second part now is that virus itself, COVID-19 virus itself, can worsen your glucose levels. A lot of studies have been done actually. King's College in London, Monash University, even Indian collaborators are there who are contributing to this. So basically, they are trying to look at how the COVID-19 virus is affecting the pancreas. Pancreas में beta cells होते हैं. I will not go into too deep into this physiology and science, but pancreas में beta cells होते हैं जो insulin produce करते हैं. वहां पे एक ACE2 नाम का receptor होता है, and that receptor the COVID-19 virus gets attached to. So basically वो जो COVID-19 virus है, that can affect your beta cells of pancreas and affect your insulin production. So उस हिसाब से this is just in short. So COVID-19 virus itself directly also can affect your glucose levels. So as I mentioned, the few pointers, that's how our patients with diabetes have to manage it.
So basically, if you already have diabetes, then either through the medicines that you're prescribed or through the action of the virus itself, the diabetes can get worse. So similarly, is it correct that it can also cause like new case of diabetes where you didn't have diabetes before?
Yes, yes. Again, very, very important. And we have seen some cases, and what I mentioned, this study going on, King's College London and Monash University. So basically, what they are trying to see is how many patients who have COVID-19 infection who do not have diabetes at that point of time. जब COVID-19 उनको हुआ है, उसके पहले भी हिस्ट्री नहीं है, और जब हुआ है तब भी डायग्नोसिस उनका डायबिटीज का नहीं है. After that, after COVID-19 infection, how many have diabetes, develop new onset diabetes? So there'll be many, I should say, confounders here, because समझिए, if the patient is already overweight or if the patient has pre-diabetes. I think we had a session on pre-diabetes last time, कि pre-diabetes क्या होता है, borderline diabetes what we call it. अगर patient अगर वजन ज़्यादा है या patient को pre-diabetes है, such cases will definitely be at higher risk of getting converted to diabetes here, because COVID-19 itself is a form of stress. Body में जो stress होता है, उस वजह से भी शुगर अफेक्ट होता है. आई मेंशनड अबाउट द बीटा सेल्स गेटिंग अफेक्टेड बाय द वायरस. स्टीरॉइड्स अगर दिए जाएंगे तो देयर समथिंग कॉल्ड एज स्टीरॉइड इंड्यूस्ड डायबिटीज. जिनको लॉन्ग टर्म अगर स्टीरॉइड्स दी जाए किसी को भी, तो उनको डायबिटीज हो जाता है, बट दैट इज स्टीरॉइड इंड्यूस्ड डायबिटीज. दीज आर द फैक्टर्स, बट डेफिनेटली वर्क इज गोइंग ऑन इन दिस फील्ड इन टर्म्स ऑफ getting to know more ki, can this virus cause diabetes. And there is definitive evidence now that there are some cases who may have new onset diabetes because of this COVID-19 virus. This virus also may affect your autoimmune system sometimes. And there are some reports ki, we are mainly talking about type 2 diabetes, जो lifestyle disease है, जो वजन से होता है, या जैसे last time हमने discuss किया था, lack of activity, lack of exercise and all that. But अगर autoimmune उसका picture आ गया, तो that can cause a type 1 diabetes like picture also, which can actually affect the insulin production directly from the beta cells. So there is evidence that new onset diabetes may be caused with after COVID-19 infection, but definitely, studies are going on, and we would need to have more details in that.
Okay. And the diabetes that occurs as a outcome of COVID or COVID treatment, is it exactly the same as any other kind of diabetes? Is it reversible, curable? Like when we go on to management and
Okay.
treatment?
So yeah, this will be a bit difficult to comment. I do have a few patients, my own patients जो COVID-19 के लिए admit हुए थे, as I mentioned, exactly the same picture कि उनको diabetes नहीं था, but they were given steroids or some of them were not, and on discharge जब एक महीने बाद या 4 to 6 weeks बाद, when we repeated the glucose levels, when we did their HbA1c levels, they were higher than before. So I had to label them or diagnose them as diabetes, and they are being treated. So I think curable या reversible या what we call it as remission, it's too early to comment on, because see, the approach remains the same. If it is not type 1 or autoimmune, approach remains the same कि भाई, we work on their diet, we work on advising them the correct exercise या activity, जो भी एक बार वो COVID-19 से recover कर जाएं, उसके बाद if their weight is on the heavier side, if they're overweight or obese, we definitely aim for weight reduction. If required, we get dietitians help also, so that they can be on a proper balanced diet and aim to lose weight gradually. So approach वही रहेगा. So this, it may be difficult to answer at this stage, because this is just too early probably, in terms of data we have. तो कि reverse होगा कि नहीं, but definitely the patients we have are doing well. ऐसा नहीं है कि many of them who were on insulin initially, many of them are off insulin, they are doing well on tablets, along with good lifestyle and dietary changes.
Right. Okay. So, so far we have talked about diabetes as a result of COVID, directly getting COVID. But what about the rest of the surroundings, our environment, which is also influenced by the pandemic, like lockdowns, quarantines, isolations, work from home? How have these things had an
Absolutely. Yes. So see, as I mentioned, ये confounders जो हैं, कि पहले से diabetes नहीं था, but if the patient is overweight or obese, or if they have pre-diabetes, so all the very important pointers you mentioned, are contributing to that. The last 2.5 years, what we have seen, post COVID and lockdown. So patients have been working from home. Patients have been ordering food outside. Once that initial phase was over, all these aggregators, we are it's so easy to order food now. I want to eat something at 6:15, I order something. By the time we finish this session, my food will be there. And anything what I want, what I like from the place I like. So it's become so easy to do this, which is of course convenience hai, things, there are benefits. But if you don't utilize this technology in the right way, I know people who have one or two meals every day ordered from outside. Of course, people will be staying away from home, work pressure, stress, no time, but then you have to work up. Because why I'm concerned, because when my patients, yesterday only I was seeing a young patient who works in some kind of jewelry business. He works there, and he stays in the shop. He sleeps in the shop because and he stays away from home. He's from Rajasthan. And when I ask him कि क्या खाते हो, तो breakfast में it's in the restaurant, lunch भी एक होटल से टिफिन आता है और dinner भी टिफिन आता है. Nobody cooks. So if you're going to have, and from the hotel, टिफिन आना गलत नहीं है, but if you order it from a hotel, from a restaurant, so to say, then how the food will be. It may not be the healthiest food you can have. So first thing what I told him is that either you cook yourself, or with your friends, or if not, then get your food from somewhere which is more like home food. And luckily these facilities, at least in Mumbai, I can tell you, a lot of facilities, and I'm sure all over the country, facilities are available. Especially COVID के बाद इतना सारा हुआ है कि people are providing healthier food. Simple दाल रोटी सब्जी चाहिए. That is what his first change was. Because हर टिफिन में उनको एक स्वीट आता था, दो गुलाब जामुन है, या एक दिन कुछ मिठाई है. So you cannot eat that and treat your diabetes. That's how we got it in the first place. So this is just an example and a simple terms. But so this has had an effect. Lockdown, even younger ones also. Young people who've been doing the schooling from online. Even I've been seeing 17 years old, 18 years old also with pre-diabetes, and also with full-blown diabetes. So it's again, it has played a very, very important role in affecting our population's weight, predisposing them to pre-diabetes and diabetes. Because घर पे रहना ठीक है, but when you go out, how much you walk, how active you are, that plays a very important role. Also with interactions, at home, also work from home has its own stress, which come with it. So these are a few factors which have affected big time, and they do play a role when we are talking in context of COVID-19 here. So, and not everyone gets their blood sugar or blood levels checked every year. So ये 2 साल में सबने check नहीं किया है. If you go home and you start checking everyone, because when we talk about the numbers of diabetes in India or in any country for that matter, we talk about a hidden burden. मतलब कि जो मालूम नहीं है कि इनको डायबिटीज या प्री डायबिटीज है, दैट बर्डन इज ह्यूज. जो मालूम है, जिनका चेक हो गया, जिनका कंप्यूटर में आ गया, व्हाट कम्स इनटू द डेटा ऑफ द रजिस्ट्री, दैट वी नो, व्हिच कम्स अराउंड 10 or 11%. बट जिनका मालूम नहीं है, दैट इज अ बिग बर्डन. सो नाउ यू गो होम, होम टू होम अगर अपन ने किया और चेक किया सबका, वी आर गोइंग टू बी वेरी वेरी शॉक्ड एंड सरप्राइज्ड, to find new onset pre-diabetes and diabetes. And this lockdown, this work from home, and the kind of food many of us are having is has a very very important role to play.
And something else that our members of our community have been wondering about is with regards to the vaccinations, and the if there is any specific impact on diabetes patients, if there is anything that they need to look out for specifically with regard to the
Okay.
vaccinations.
Yeah, again, very very important. So do get vaccinated first of all. There are no रियल साइड इफेक्ट्स, आई शुड से. whatever data you see, ऐसा नहीं कि अगर आपको डायबिटीज है तो आपको अलग से कोई साइड. आई हैड वन और टू पेशेंट्स जो, जब मुझे कुछ महीनों पहले, लास्ट ईयर की बात है, when they came to see me after a long period, or when I did a video consultation for them, I asked all my patients कि अभी तो I asked about 2 doses, have you taken both doses of vaccine. एक टाइम था कुछ महीनों पहले when I was asking कि आपने पहला डोज लिया, depending on the time. So one or two answers were कि नहीं सर, वो तो मेरे को शुगर है इसलिए मैंने नहीं लिया, क्योंकि मालूम नहीं है. So of course, so even if you have diabetes, take your vaccine. उसके बाद side effects, whatever the minor body aches and myalgia, जो पैरासिटामोल लेना है, what all these are same for everyone. उसके अलावा कोई ऐसा नहीं कि डायबिटीज है तो कोई सीरियस या सीवियर साइड इफेक्ट आपको अलग से होगा. Some patients, I should say, rarely a few patients have mentioned कि and I don't have any data or study about this, but 2 से 3 दिन तक
वैक्सीन के बाद sugar levels did fluctuate a bit on the higher side. But this was just mentioned by a few patients, but it was mentioned, so I'm just sharing here. But ऐसा कुछ नहीं है कि vaccine will. So please take your vaccines. In fact, अभी above 60, I think 10th or 11th Jan से booster dose is what we are calling as precautionary dose. वो भी शुरू हो गया if you are above 60 age, and also if you have comorbidities above that age, you are eligible for a booster dose if you have completed 9 months of your second dose. तो second dose के 9 months अगर आपके पूरे हो गए, you would have got an SMS also to the number linked to your vaccine certificate or your COVID app. तो आप बिल्कुल check कीजिए and take your vaccines please, so that that's the only thing which is protecting us apart from the mask and the other basic precautions.
And so something else that has come up is basically that, I think you had discussed sick day management. So basically, there are a lot of people who have to take medicines for their diabetes, or they have to take insulin for their diabetes. And if they get COVID, then they have to also take medicines for that. So what are some things that they need to keep in mind, with regards to taking both sets of medications at once?
Yeah, yeah. So so as I mentioned earlier, a few things are कि basic चीजें तो सारी same रहेगी, whether it's COVID-19 infection or any infection which happens. So our patients who have diabetes and are listening, these few things are common for any infection you have now or you may have any time in the future. Or any one of your family member has who has diabetes. तो अगर कोई भी आपको infection होगा, be it COVID-19, any form of infection is a form of stress to the body. स्ट्रेस बढ़ने से बॉडी में कुछ हार्मोनल चेंजेस होते हैं जिससे आपकी शुगर जनरली बढ़ती है, बट कभी कभी बिकॉज ऑफ फ्यू अदर फैक्टर्स, लॉस ऑफ एपेटाइट, वॉमिटिंग एंड ऑल, कम भी हो सकती है. तो वन इंपॉर्टेंट थिंग, बेसिक थिंग, अगर आप घर पे मैनेज कर रहे हैं अपने आप को, इज मॉनिटर योर ग्लूकोज लेवल्स एडिक्वेटली. अगर आप चेक करते रहेंगे अपने शुगर लेवल्स, सो यू कम टू नो कि विच साइड द लेवल्स आर गोइंग. And whenever you consult your doctor with those things, doctors, when patients come to you with a fasting and a PP report, for example, anytime when you see your diabetes doctor or your endocrinologist or your physician with your fasting and PP report, वो fasting और PP report सिर्फ उन 12 घंटे की रिपोर्ट बताती है. And when a patient comes to me with, say, he monitors just weekly once, या 10-15 दिन में एक बार चेक करते हैं, बट वो पूरा चार्ट लेके आते हैं लास्ट 2 महीने का, 3 महीने का. आई एम टॉकिंग अबाउट स्टेबल पेशेंट्स. Then I come to know कि भाई पूरे 2-3 महीने में क्या ट्रेंड रहा है. Of course, we do HbA1c also, which is glycosylated hemoglobin, which is a 3 monthly average glucose एवरेज. बट सो अगर आप बीमार हैं तो आप रेगुलरली चेक कीजिए, तो आपको मालूम पड़ेगा. और जब आप डॉक्टर को कंसल्ट करते हैं, उनको भी अच्छे से मालूम पड़ेगा कि भाई ग्लूकोज कैसी चल रही है. आप एक बार कर रहे हो सकता है कि 300 आए, बट अगर आप अगली मॉर्निंग कर रहे हो सकता है 75 आए. When you are ill, and especially when you are treated with something like steroids, which we are talking about COVID-19, not in this way, but earlier it has been used, and we don't know about the future. तो अगर स्टीरॉइड या ऐसी कोई दवाई यूज हो रही है तो शुगर्स कैन फ्लक्चुएट वाइडली. एग्जैक्टली द एग्जांपल आई सेड कि आपका दोपहर का या शाम का शुगर 300-400 भी आ सकता है, बट देयर आर सम स्टीरॉइड्स जिनके एक्शन की वजह से दिन में या शाम तक शुगर बढ़ता है और अगली मॉर्निंग फिर से 70-80 आता है. इफ यू डोंट चेक 2 or 3 टाइम्स अ डे, यू वोंट कम टू नो. और अगर आप अपनी वही दवाइयाँ लेते रहेंगे या रात को आपको कुछ ऐसी दवाई है या टैबलेट है या इंसुलिन है, तो मॉर्निंग में लो की शुगर की रिस्क भी बढ़ जाएगी आपकी. It's not only about high sugar. Diabetes is not only about managing the highs. It's also about avoiding the lows. लो शुगर को भी अपने को अवॉइड करना है, which is a very very important thing, because समझिए ना कि आप अगर शुगर 200, 250, 300 है, immediately you may not have any symptoms 1 or 2 days. But अगर आपका एक सिंगल शुगर अगर 50 या 60 आ गया, the audience listening, they will understand what I'm saying. जिनको डायबिटीज है और जिनको हाइपोग्लाइसेमिया हुआ है कभी अपनी दवाइयों की वजह से या मिस्ड मील की वजह से, अगर आप एक शुगर 50 या 60 या 70 का लेवल आ गया, they will have so many symptoms. They can have giddiness, they can have profuse perspiration, पसीना आता है, घबराहट होती है, ट्रेमर्स आते हैं, कभी कभी ड्राउजी जैसा हो जाता है, स्पेशली एल्डरली अगर पेशेंट्स होंगे जो मदद भी नहीं कभी कभी मांग सकते हैं. सो एज आई मेंशन, इट इज इंपॉर्टेंट टू अवॉइड द लो शुगर लेवल्स ऑल्सो. सो मॉनिटरिंग इज इंपॉर्टेंट. सेकेंड पॉइंट इज एडिक्वेट हाइड्रेशन, मतलब आप पानी अच्छे से पीजिए. ऑफकोर्स अगर आपको हार्ट की तकलीफ है, किडनी का तकलीफ है, अगर पानी का भी लिमिट किया गया है कि यू बीन एडवाइज्ड बाय अ नेफ्रोलॉजिस्ट और कार्डियोलॉजिस्ट टू लिमिट इट अप टू 1 to 1.5 liters, or even lesser sometimes, then that's a different issue. But I'm talking about an average patient who does not have other comorbidities. So adequate hydration, adequate and proper glucose monitoring, dose titration is required. Eat your meals on time, and खाने में भी जैसे basic principles will apply कि आप biscuits हैं, breads हैं, the refined carbs what we talk about, sugary drinks, avoid them. Have your fruits, have your nuts. which will give you good amount of nutrition. And apart from that, a regular balanced diet, salads, sprouts, and of course the other things. I'm sure you should. In fact, as we were discussing the other day, you should be arranging a session with the dietitian also, regarding this NAMA, which would benefit our audience well, because this again can be a long discussion. So diet अपन आप patients अच्छे से रखें. And apart from that, of course, get in touch with your doctor, because कितनी बार होता है कि patients try to self manage अभी, because this COVID wave is not that bad as it is. We see patients are not requiring admission, but ऐसा नहीं है कि all patients are not. We still have our ICU which is almost full. We still have patients in our hospital with COVID-19. And why are they in the hospital? Because they have comorbidities. मतलब कि या तो उनको डायबिटीज है, या हार्ट की बीमारी है, या किडनी का कोई प्रॉब्लम था, या ट्रांसप्लांट पेशेंट है. तो बेसिकली इट्स ऑल अबाउट देम ओनली, बिकॉज जिन पेशेंट्स को वो है, उनको अगर कोविड-19 हो गया तो प्रॉब्लम आ रहा है, एटलीस्ट इन दिस वे. अर्लियर इट वाज फॉर इवन हेल्दी पेशेंट्स एंड यंग पेशेंट्स आल्सो. तो बेसिकली फॉर टू टेक केयर ऑफ देम, आप अगर अपनी बीमारी का, नॉट ओनली डायबिटीज, अगर आपको ब्लड प्रेशर है, हार्ट की प्रॉब्लम एंड अदर थिंग्स व्हिच आई मेंशन, उन चीज ब्लड प्रेशर भी अच्छे से कंट्रोल करना होगा. अगर कोलेस्ट्रॉल लेवल्स है, अगर आपको वजन ज़्यादा है, देन ऑल्सो यू आर एट रिस्क. ओवरवेट और ओबेसिटी अगर होता है, तो even then you are at risk, because once you get any form of infection or get COVID-19, for example, you will find it difficult, because sometimes things can be compromised. So these are the few things we need to take care of.
Yeah, and even for insulin, the same guidelines would apply, right? It is important to keep
I
testing and also
Yes,
to
broadly same as I mentioned कि हाई शुगर्स को भी अपने को मैनेज करना है, और ये भी इंश्योर करना है कि लो ना हो जाए. इंसुलिन, इट्स a very high risk drug, so to say. High risk means कि uh, a single wrong dose, you know, can cause lethal complications. एक गलत डोज अगर हो गया है, 10 लगाना है, 10 की जगह अपन ने डबल कर दिया या ज़्यादा लगा दिया, पेशेंट का शुगर एकदम से लो हो जाएगा. सो थिंग्स हैव टू बी वेरी वेरी क्लियर इन द पेशेंट्स माइंड और इन द केयर गिवर्स माइंड कि भाई इंसुलिन कैसे लगा रहे हैं, कितना लगाना है. वन. सेकेंड इज अगेन मॉनिटर योर ग्लूकोज वेल्स, एज आई मेंशन कि बिकॉज ऑफ इन्फेक्शन लेवल्स विल फ्लक्चुएट. तो कभी कभी उस हिसाब से अपने को इंसुलिन का डोज भी एडजस्ट करना पड़ता है. अगर ग्रेजुअली एक रीडिंग पे भले ही नहीं, बट अगर हर शुगर अगर 300 350 आ रही है, तो विच मीन्स कि द करंट डोसेज इज नॉट वर्किंग वेल. एंड द अदर वे अराउंड की सारी रीडिंग 100 के नीचे आ रही हैं, या 80 आ रही है, फिर 60 आ गया, 2 बार आज हाइपोग्लाइसेमिया हो गया, शुगर का पानी पीना पड़ा, विच मीन्स कि प्रॉब्ली यू नीड टू स्टॉप और एडजस्ट योर डोसेज अगेन. That's where the role of doctors come in. You must contact your doctor immediately, so that doctors can act on it and guide you appropriately. Glucose monitoring is important, and dose titration is important.
So basically, what you would say is that even while people are dealing with COVID, it is important for them to keep in touch with their diabetologists and get their advice as well throughout the process. Right?
Definitely, or whoever is managing the diabetes, even family physicians we have who manage diabetes so well. तो जो भी आपके diabetes के डॉक्टर हों, आप उनसे टच में रहिए, and they should be able to guide you well. Yes.
So, so in today's session, just to recap, we have talked about how the relationship between COVID and diabetes, how both of them can have an impact on the other. How we have seen that COVID symptoms get worse where people already have diabetes. We have also seen that people who may not have had diabetes before or who had it, but when they get COVID, their symptoms get worse, the blood sugar levels are higher, either because of steroid medication or any other medications, or even because the COVID virus itself is affecting their pancreas, affecting the diabetes. And we've today we have also talked about the general pandemic culture, how lockdowns and isolation, a more less active lifestyle, in fact, has contributed to a general increase in blood sugar levels, in how we manage and control diabetes. And we've also talked about the importance of vaccination, not just for COVID, not just to prevent against COVID, but also that it doesn't really have any bad effects for people who have diabetes, that it is safe to take. And that is a concern, I think, for a lot of people who have diabetes. And we've also talked about medication and insulin, how to manage it while having also COVID medications, and how the importance of testing frequently, monitoring glucose levels, keeping in touch with our doctors. So I just really want to thank you, doctor, for taking the time out today for to speak to us about this really important topic, which I think, especially since we are in the middle of a third wave right now, a lot of people are really worried about it. It's a big concern. So thank you so much for taking the time to discuss this with us, and thank you to everyone who has tuned in this week for the live session. We really hope that this was helpful and informative for you. And please check back in next week. We will have another live for you next week as well. And please stay home, stay safe, everyone. That is just so important. And yes, thank you
Sure.
to everyone.
Thank you. Thank you for interacting.